Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. February is American Heart Month, and cardiovascular health remains a growing public health threat. Now, although nearly 34 million American adults are being treated for high cholesterol, 1 in 4 still don't have it under control. That puts them at increased risk for cardiovascular disease, which is, of course, the number one cause of death in the United States. Well, here with more information and some facts about managing cholesterol that everyone needs to know are Katherine Wilemon, founder of the FH Foundation, and Dr. Pam Taub, a cardiologist at the University of California in San Diego. Thank you both for joining us.
Pleasure to be here.
Dr. Taub, I, of course, mentioned you're a cardiologist at the University of California. Give us a brief background into your area of expertise.
I am a preventive cardiologist. My practice really focuses on preventing cardiovascular disease, both in people that have had events and in people that are high risk for events. I also run our Cardiac Rehabilitation and Wellness Center, which is also focused on preventing future events.
And Katherine Wilemon, if you could give us a brief look into your background.
Sure. So I am the CEO and founder of an organization called the FH Foundation, or the Familial Hypercholesterolemia Foundation. Mm-hmm. I have FH, which is why I started this work. Most people who have FH are undiagnosed, and even the medical community is not highly aware of how common and life-threatening this condition is.
Dr. Taub, give us some information about some contributing factors to high cholesterol and some of the risks that we're going to talk about.
Well, the typical risk factors for high cholesterol really stem from lifestyle factors, such as what you're eating, how much you exercise. And when we talk about cholesterol, we need to really think about two primary components of the cholesterol, and that's the LDL cholesterol, or the bad cholesterol. I like to tell patients the way to remember it is L for lousy. And then there's the HDL cholesterol, or the good cholesterol, and the way to remember that is H for high. You want that number to be high. And so those are the numbers that we really want to focus on improving. And when people can't get these numbers to optimal levels with good lifestyle modification, then we need to be thinking about genetic factors such as familial hypercholesterolemia, which is what Katherine has. Mm-hmm. And for people who have genetic factors, we really need to be using pharmacologic therapies in addition to lifestyle to get their cholesterol numbers to where they need to be.
Katherine, having FH, talk a little bit about some of the symptoms, some of the things that led to your diagnosis, and maybe some of the lifestyle factors that Dr. Taub was talking about. Were they factors in your case as well?
Well, I had always known from the time I was 15 that my LDL, or lousy cholesterol, was extremely high. It was actually in the 300s. And so I had eaten a very heart-healthy diet since I was young and really made an effort to exercise. Nevertheless, at the age of 39, I had a heart attack where the main artery that feeds blood to my heart was actually completely blocked. And I was so lucky to make it to the other side of that. What I discovered subsequently was that for many people, having a heart attack or needing to go in for bypass surgery or a stent placement is the first sign. And it shouldn't be that way, because LDL cholesterol is easy to measure, and we have lots of therapies to treat it. But for people with FH, lifestyle is important, but it is not the cause. And that's really why it's so important to talk about it, FH, and what drives high cholesterol is to have people differentiate. Is it genetic? Do I need to start medications early? And what are the safe levels of LDL I need to reach?
So how do you know if your high cholesterol is caused by FH or some other factors that people that don't have FH are dealing with? And if that's the case, what should you do?
So it's really simple for someone to understand whether they may be at risk for FH. They need to look at their family history. Is there a history of grandparents or uncles and aunts having heart attacks or needing some kind of surgery before they're 50 or 60 years old. If that's the case, you need to really consider that you might have FH in your family. And the other variable would be to get your cholesterol level checked. And what people need to do also is to have their family members checked. This is a condition that's very easily inherited. So each child, each sibling will have a 50% chance of also having the condition. And with therapies that exist now, there's so much that can be done. People's lives can be extended for decades without heart disease. And it's one of the reasons we're really excited to partner with companies like Esperion to raise awareness, because if people know early they have the condition, there's so much they can do.
Dr. Taub, besides seeing the doctor and getting a lightly invasive blood test, what else can folks do to kind of manage their cholesterol levels?
Well, I think the first step is just understanding the cholesterol levels and really understanding your numbers over time. And one of the best resources for a better understanding of cholesterol levels is the FH Foundation website, which is just the fhfoundation.org. And once people understand their numbers, then they can get a lot more insight into what's working and what's not, because not every single lifestyle strategy works for everyone. And some of it needs to be customized for that particular person. So understanding the numbers and then making changes. And we talked about lifestyle changes, so improving what we eat. And it's things such as just decreasing saturated fat that's found in red meats, fried foods, processed foods, increasing the amount of exercise that we do every day, and then talking to your doctor about those numbers and figuring out a strategy that synergizes on both lifestyle and all of the new pharmacotherapies that are available in 2021 for lowering cholesterol levels.
Is a statin always part of the therapy, especially if someone has FH, either Dr. Taub or Katherine?
Well, I can take that question because I use statins all the time. They're really the cornerstone of therapy for management of high cholesterol, and they have been for the past 30 years. However, people do get side effects with statins, and some of the common side effects are muscle aches, and so we can't get people to the levels of LDL cholesterol that we need them to be with just statin therapy alone, and that's when we have to use some of the newer non-statin therapies in addition to statin therapy. And this is a complex discussion that needs to be had with your physician in terms of what are the optimal therapies that a particular individual needs.
Katherine, could you give us a website where we can go and get more information about the FH Foundation and a little bit more about your story as well?
People can find us at thefhfoundation.org. We have phone numbers where people can call. We can help them to look back at their family history and understand if they might have familial hypercholesterolemia and to find a doctor near them, regardless of where they are actually in the world.
Well, I appreciate you both joining us on the program this morning. It's been a pleasure speaking with you. Thank you so much.
Thank you.